Does red light therapy help with shedding? Can hair shed on a GLP-1? And if you've lost hair from a GLP-1, can you get it back? I'm 47 and perimenopausal. What is actually causing my hair loss right now? Is it hormones or something else? Let's talk about expensive hair vitamins. We talked a little bit about some supplements. Do you think they're worth it? Is it common for hair to suddenly change texture? Mine has gone completely curly and I don't understand why. What shampoo brands actually help with hair loss? Are there any specific ones? My hair is thin since starting bioidentical hormones. Is this common and what can I do? You're not supposed to towel dry your hair when it's wet. Is that true? What are some of the ways I can help with hair loss that don't require medication? You could do... Hi there, ladies. Welcome back. I am so glad you're here. All right. You may remember a little while back, I did an episode on hair loss. It was actually not a little episode. It was an enormous episode. It blew my mind. I had DMs, I had comments, I had emails. You came flooding in with questions and stories. And I just kept thinking, we have got to go deeper on this. So we thought we'd give it some time, but the questions kept coming in. So we decided to bring in the expert and get questions answered. And so that is exactly what we're going to do in this episode today. I brought in my own dermatologist, who I adore, and somebody I genuinely trust with my own hair and skin, Dr. Doris. She's a board-certified dermatologist based right here in New York City. She is a clinical professor of dermatology at NYU Langone and has been named one of the top 3 cosmetic dermatologists in the entire country. And she's been my doctor for years now. So when I say I trust her, I mean it personally, not just professionally. And with all those things going on, the fact that she's here today to answer our questions, I think is just speaks volumes about her. A majority of the questions that came pouring in after that episode were about hair loss. And here's the thing about hair loss, and that I think we don't talk enough about. It's not just a cosmetic issue. For women especially, losing your hair, I truly have seen this. It touches something deeper. Your identity, confidence, the way you show up in the world, at work. And this happens at every stage. We're not just talking about menopause, not just after having a baby. It can happen at any point and feel really, really isolating because most people aren't talking about it. By the end of this episode, I want to make sure your questions are answered. And we also want to make sure you have real tools. So by the way, Dr. Day brought in an entire toolkit of stuff to show us how to manage going into this next chapter, because I want you to feel confident. When you look your best, you feel your best, and I believe you deserve both. So before we get started, one thing, if you have a moment while you're listening, please leave us a review. It really helps more than you know. It helps other women find the show and helps us bring in really incredible guests like Dr. Day. And here's a little secret my team asked me to share. We have been selecting random reviews and then sending a free copy of my book, How to Menopause, because it is the 1-year birthday of the book, to people who are leaving a review. So you never know. Leave a review and we might just reach out. All right, Dr. Doris Day, let's go ahead and get into it.
I'm ready.
I feel like you came in with this bag and I can't wait to dig into that. But I have to ask you this first of all. First, thank you for coming here and answering these questions, because I am not exaggerating when we ask for questions and we want to know what people are talking about. This conversation ran so deep with so many different kind of questions. So I appreciate you taking the time to be here.
Oh, it's absolutely my pleasure. And this is a big conversation, even in my office. So I get why it matters to people.
Why is this conversation so emotional when it comes to hair and hair loss?
We're hardwired to care about hair. It's actually inscribed into our DNA. When you have thick, healthy hair, it's a sign of youth, fertility. It helps shape beauty. So people don't choose to care about hair. We instinctively care about it. But the reality is, it really is just hair. And there's so many ways around it. So what we have now is we have better treatments for hair loss than we did. We have better ways of recognizing why hair loss happens. And there's new treatments coming, both that exist in the early stages and ones in the pipeline. So there's a lot more we can do about hair today, and that makes it a better conversation. It's not just looking at someone and saying, okay, you have hair loss, that's it. Now it's, you have the beginning stage of hair loss. These are all the things we can do about it. Only a few are FDA approved. Most of it is off-label, but there's still pretty good data on a lot of these treatments and so much in the pipeline.
I feel like it's so reassuring to hear you say that there are options versus good luck and,
Yeah.
not too many options available. So is there a common type of hair loss?
Well, there's a common type of what people perceive as hair loss, which is really stress shedding.
Okay.
That's called telogen effluvium. Telogen is part of the hair cycle, and it's a stress shedding. So a stress shedding can happen from anything. But what people have to understand first is that you have hair cycles. So your hair has a growth phase, and on your head, it's 2 to 10 years. That's how long your hair can grow. Then you have a transitional phase, a resting phase, and then it falls out and it regrows. So you have anagen, catagen, telogen. Those are the phases.
Anagen,
growing. Catagen is that transitional,
Catagen.
and telogen is that resting phase. So the anagen phase is 2 to 10 years, and the catagen, telogen is 3 to 4 months. So when you have a physiologic stress, it could be emotional, it could be physical, it could be chemo, it could be childbirth, it could be a divorce, a wedding, good things, bad things, all these things that stress you, even change of season can be a physiologic stress on us. And there's a 3 to 4 month lag. So when you have that stress, the hair, that 90% of which is sitting in that anagen or growth phase, all of a sudden should shift or does shift, shouldn't, but it does, into that resting phase where it sits for 3 to 4 months, then it transitions, falls out. So that is why when you have a stress, if someone says, oh, I'm stressing, my hair's falling, that doesn't make sense. When you stress, your hair shifts from growing to resting, and then it falls out months later. So when someone says they have hair loss, I go, what happened 3 to 4 months ago? Did you give birth or go through a major life issue? And then you'll see that lag. But the problem is that you can have more than one cause. So arresting, so that stress shedding, that telogen effluvium, if it's chronic, if you're undergoing chronic stress, the hair does grow back, but it sheds.
And then
so it's a net loss.
It's interesting. I went through a divorce and then I never forget it. I don't even know what was going on. And I looked and I'm like, my hair feels weird, like thin. I have very thick hair and I have coarse hair, right? And the ends were like straggly. And I actually went back and looked at old pictures and I went, wow, like I'm assuming that's what caused it, but it happened for a while. It wasn't like in the months that I was, signing the, going through my actual physical divorce. But you're right. It was like maybe 3 to 6 months later, I guess, thinking back on it.
And it can take a year to cycle back, but it can also accelerate a female pattern hair loss.
Okay.
So you don't just have one cycle. Now, when you have a stress shedding, people will say, I see hair everywhere because your hair is shedding.
Yeah.
When you go through a female pattern hair loss, you don't necessarily see hair everywhere because what happens is before the hair even falls out, each strand becomes finer and it miniaturizes over time. So what people will say is my ponytail is half as thick as it was. They don't necessarily see hair everywhere. They may have some shedding and they may be more attuned to hair shedding, but it's really that the hair they have, like you have coarse hair, but hair naturally becomes finer with age for most people. And then genetically, it can be programmed to become finer. And that's when you, on top of that, see the part widening. So male and female patterned hair loss is very different. Men will have more receding temples, then it can move back, they lose the crown, and then they go bald. For women, the part down the middle gets wider. They notice temporal thinning as well, but they have more diffuse shedding of the crown and they keep the frontal hairline. So they're slightly different patterns. But what we're learning is that in both of these patterns, there's some inflammation at the base of the hair follicle. So the hair follicle is becoming a real focus for treating hair loss. And we're finding that as great as it is to understand that there are stem cells there, this is an active site of growth, it's also really hard to reach. It's immunologically protected. So getting things to get to the hair follicle is not that easy, and that's one of the challenges of treating hair loss. So treating hair loss is problematic, but we're looking at microinflammation, and we're looking at shampoos that can minimize inflammation. We're looking at even products that can do that. Now we're learning that hair follicles have olfactory, like they have smell and taste receptors. Your hair follicles do. So even though they're in an environment that doesn't correlate with the brain for smell and taste, things that have sensory, like sandalwood, can affect the follicle and promote hair growth and can affect bacteria that are part of the hair microbiome that can affect hair growth.
Sandalwood, like the oil?
Yeah.
Okay, don't go throw that in your hair yet, though,
No,
right?
don't throw it in your hair. No, but and it's going to be an extract of it. But the hair, the hair has sensors. Even people who are losing hair will notice that their scalp hurts. There's sensations that people have around hair loss that we can't fully scientifically explain now why they have those sensations. But the more we're getting to study the follicles and proteins that are there, even potentially GLP-1 sensors that are there that can affect people who are doing GLP-1 that actually might help hair growth, not hurt it. There's so many things we're learning about the hair follicles, about proteins and peptides and sensors and how to actually reach that follicle to help the hair grow that goes beyond just minoxidil, which seems to be working by improving blood supply to the area, or what men take, which is finasteride that affects enzymes and hormones that are there. So we're expanding the treatments and the options and the approaches way beyond what's currently available.
It's such good news, and I think it's reassuring to a lot of people who are listening. All right, I'm going to go through some of the questions, if that's okay. And
Great.
I know we actually have a voicemail to listen to as well,
Okay.
but let me start with this one. I spent my 20s going to multiple doctors and dermatologists, and they all told me it was stress and poor diet. I recently saw another derm who said the same thing. Why do doctors keep dismissing this, and what is actually going on?
Hair is really hard to treat, and even most dermatologists, most doctors don't want to be bothered with it. You have to see a hair specialist who will take the time to look at your scalp and see what's going on for you. So she could be having chronic stress, but we need to hear the whole story, and there are things that we can control. So it could be that she has early onset female pattern hair loss on top of a stress shedding. And sometimes when you have hair loss and then you start stressing about the hair loss, you create hair loss through the stress shedding.
It makes sense.
Yeah.
It makes sense.
But even if somebody has chronic stress shedding, there's things we can do for it.
Okay.
So we can talk about even things like vagus nerve stimulation just through breath work. Just box breathing, where you breathe in for 5 seconds, hold it for 5 seconds, breathe out for 5 seconds, hold that for 5 seconds. Do that for 2 minutes several times a day. You lower your heart rate, you lower inflammation, and that is free. You just do that at home. It's good to do anyway. Meditation, walking, all those things are helpful. Getting enough protein is essential. Controlling your weight fluctuations is important. Worrying about your sleep patterns, all of those things affect it. So when somebody has something like hair loss, if I don't see scarring in the scalp, if I don't see a specific pattern that I can point to, then we talk about lifestyle changes we can do. We talk about PRP, which is where we take blood, spin it down, inject it back, things that are going to support the nutrients of the scalp to help hair growth. But you never, ever dismiss it and tell someone it's just stress, get over it.
Every time I hear that, and I feel like women hear it more than anybody does, right? In every stage of our lives. Thank you for that as a doctor. Thank you. I'm 47 and perimenopausal. What is actually causing my hair loss right now? Is it hormones or something else?
Yes.
I was going to say, I'm not a doctor and I can answer that. Gosh, those hormones, man.
Yeah, it is hormones and it is something else. It's hormones in that estrogen is important for hair growth. Testosterone is important for hair growth. And I think it is a good idea and it is a sign that it's good to add some estradiol back unless you have a specific reason not to. And too many women are dismissed because they have a family history of breast cancer, or their doctor's just afraid to prescribe it, or it's just too easy to tell them just to not bother and you'll be okay, you'll get through this time, which is ridiculous.
Yep.
But I would definitely say it's a sign that you should consider menopause hormone therapy, and then also add, if you can, oral or topical minoxidil, which does help hair. I used to be a little bit more hesitant about oral minoxidil because of some of the side effects, which is potentially swelling of the lower legs, fluid around the heart. But I've spoken with enough cardiologists that I think at the doses that we're using, the risk is low and it doesn't seem to be a great concern. So I've gotten more comfortable with it.
Both of those are prescription?
Nope.
No?
No, the topical minoxidil is over the counter at the drugstore without a prescription.
Okay.
Even though it's a prescription drug, it's available without a prescription at the drugstore.
Okay.
The oral minoxidil is through your dermatologist. And generally what I have women do is start with, I give them a 2.5 milligram pill, which is cheap from a drugstore, from a prescription, and then they cut it in half and just take a half a pill a day.
Okay.
And then after a few months, if they don't grow hair on their face, if they don't have side effects, fast heart rate or other issues, then they can go up to the 2.5 milligram pill. And then the biggest risk is really that you can grow hair where you don't want it. And that's never fun. So some people don't mind because they get the hair where they want it. But a lot of women are really happy with that. Topical minoxidil is a little bit messy. And the oral minoxidil minoxidil around menopause seems to be more effective than the topical because your body metabolizes it, and then it seems to have a different effect than just using the topical. And there's a company now doing a study and creating a new drug that's a slow dose, time release minoxidil that's oral that I think would be really exciting. And that should be out in a year or two.
Okay. This is a voicemail I'm going to play from Suzanne out of the UK asking a question.
Hi, Tamsen. My name is Susanna Bereni. I am calling from the UK, London, just outside of London, and a fan of the show and listen to your podcasts. I am 47 years old and going through, I think, perimenopause. I don't really have that many symptoms yet, but one of the big things that hit me recently was hair loss, hair shedding. And I have a couple of questions about that. Why is that we are being told, at least in the UK, that we are losing on average about 50 to 100 or sometimes even, some people say, up to 150 hairs a day? I sometimes have a feel that the reason why we are being told that because nobody really knows that is this what's the average, and it depends on hair density and
Okay. What are your thoughts about that? That's, again, perimenopause.
So with perimenopause, the estrogen cycle is going through a roller coaster. Some months you have almost no estrogen, some months it's really high estrogen. That's a physiologic stress on the body. So you can go through stress shedding, and you're also having less estrogen overall, and that can affect the hair quality of each strand. She is right. You do tend to lose 100 to 150 hairs a day. That's been measured over time, and that seems to be the norm. But it's that the hair becomes finer, the shedding can become more, and this can cycle for a while. So she may notice that she's stress shedding, but the hair quality is also changing and the density is going to go down.
Is that somebody you would recommend for minoxidil?
Absolutely.
And then would there be anything else? I know there's a lot of different hair growth, there's supplements, there's all sorts of things. Would you recommend those, or would you go to minoxidil first?
I think they all work differently. So it depends on how much it bothers someone. Okay. So if somebody isn't that bothered, I might just start with a supplement. So we do things like vitamin D with K, make sure that they're getting enough magnesium, making sure they're getting enough protein, doing resistance training, all these things that are good for you that you should really be aware of to start being better about around perimenopause, because we want to age well overall. Then I'll add in a shampoo that has anti-inflammatory benefits. You can get that at the drugstore, like an anti-dandruff shampoo that has either selenium sulfide or zinc parathione. Any of those are helpful. And then, or ketoconazole, that's also good. So you want to minimize inflammation. Sometimes the yeast overgrowth, even if you don't have dandruff, that can help. And you just do it once a week or so. Then topical minoxidil, I always think of that as anti-aging because it improves the blood flow to the scalp and the follicles, and that helps hair growth. And in the studies that minoxidil did, the brand, they had almost 800 women, and 80% regrew hair, but the hair that regrew was up to 50% thicker. So it doesn't just help the hair grow, it helps the hair grow thicker. And that's one of the benefits. So I think of it as anti-aging for the hair. And if you don't mind using it, you can use the topical. If the topical is too messy or you don't like it or it's not helping, then you can see your doctor and get a prescription for the oral. And then I even like things like the supplements like Nutrafol. There's another one called Extra Say that's really good. Nutrafol Balance is geared towards women in perimenopause, and it's a cocktail of supplements that has also ashwagandha, curcumin. I think of it as better than a multivitamin, and it really covers hair loss. So I recommend that for a lot of women. But the problem now is that people are taking so many different supplements that you have to be careful that you're not overdosing on any certain ingredient.
So if you're dealing with hair loss, maybe you decide, okay, I'm just going to do the ones that are geared toward hair loss right now, to at least not, have that cabinet full of stuff that you wind up never taking in the end.
Or that you're taking all of them and you're getting too much of some things, which I think is even worse. And then you want to also, again, manage your stress. See a doctor about hormone therapy, because these are signs. And some people think if I don't have hot flashes, I don't have symptoms of perimenopause, I'm fine. But there's so much more to it.
Okay, next question. Is it common for hair to suddenly change change texture. Mine has gone completely curly and I don't understand why. And we pulled that out because I'd never heard of that before.
Oh, it absolutely changes texture. I think people notice it in their 30s. And then...
Doing what? Becoming curly all the...
Or if it's curly, it becomes wavy or frizzy. But the hair texture changes. And as it goes to gray, it becomes wiry. But the hair does change texture with time. That is normal.
That's age.
That's just age, and yeah, that's normal.
So it could go anyway. It could be frizzy, it could be wavy, it could be straight. Okay.
Yeah,
all right. Well, we're all in that boat together, folks. So
yes.
This was the one that I think, and we actually have one. Can hair shed on a GLP-1? And if you've lost hair from a GLP-1, can you get it back? And I guess I'd heard a little bit about hair shedding with GLP-1, but I never know what's like, really a thing, or a couple of people dealt with it and it's not, I don't know. What is it?
I'm really, really looking into this and studying this and trying to get all of the data. Like, do we have GLP-1 receptors in the hair follicle? When you think about it, GLP-1 might be good for the hair because it's anti-inflammatory and it's good for so many different organ systems and good for brain aging even. And I've been reading things like it helps lower risk of breast cancer recurrence even. So GLP-1 seems to be more good than bad. The problem I've been seeing with GLP-1, and it's really distressing, is I think it's causing in many people a pathologically induced anorexia, where they get thin and they look amazing, and then they keep going because they like that feeling of not being hungry and not eating. And they don't realize, I've seen so many people come in, men and women, who come in literally skin and bones. And it's really scary to see, but they don't realize it. They like the feeling. They don't necessarily like the look, but they like the feeling of not being hungry. And when they start to eat again and they start to get hungry, it worries them that they're going to gain all the weight back.
It's going to reverse or stop working. Or,
I
think
and they
this
keep
is
increasing the dose.
They keep increasing the dose, and so then they've got that going on, so they don't ever get hungry. Do you think there's going to be a time where we have this like kind of balance? We have a course correct, right, of everything. We always see that.
Yeah.
What is that course correct? Is it helpful that we now have an oral, or that doesn't really make a difference?
No, I think people will just start to realize, I see it in aesthetics all the time, where when we first had Botox, we would freeze every movement. And now we know it's about finessing and about redirecting movement, not erasing it. So I think there will be some course correction, and people will understand that this is a tool, and they'll start to get more in touch with how they feel, and they'll dose it better. But I think the first generation of people using it are really suffering, and they're seeing the hair loss as a side effect of it because they're using it and as an excuse to not eat, but they're not getting nutrition.
Got it.
So if I have someone who's going on a GLP-1 in my office, I don't prescribe it. I refer them to people. I very rarely prescribe it. It's not never, but very rarely. But I will always review with them getting enough protein, that before you start the GLP-1, plan your meals, because you're not going to be hungry and you're not going to have the distraction and the noise of like wanting to nosh on things that aren't good for you. So, or even alcohol. So plan your meals, because now you have the luxury of being able to feed yourself quality food that's really good for you, getting high quality protein and not eating between meals and doing true intermittent fasting. So people can do really well with this, but you have to put a little bit of effort into it, and you have to commit to resistance training so you don't lose muscle. And then you have to commit to understanding that there's a limit to how much weight you should lose in a given week.
I think that's a big thing, and I've not heard that conversation unless I'm just missing it. I'm not in the circles
because they're getting it online.
Getting it prescribed, you mean?
Yeah. So no one's following or really telling them about the importance of that. But if you're losing more than 1.5 pounds to 2 pounds a week, depending on your weight, you're not losing fat, you're losing muscle.
So is it possible that hair loss with a GLP-1 is due to a lack of protein or a lack of the right type of nutrients to keep hair growth? Okay.
Probably. But that's the thing, is we really have to study this to know. We have to see that if it's just a stress shedding, is it a nutrient issue? Is it a specific GLP-1 issue? And then if you look at people who do GLPs right, do we see better hair growth? So
interesting.
Yeah, if you do it correctly and you lower inflammation and you use it as an opportunity to get healthier, could you possibly have better hair growth? It can help your skin barrier. It can help with your skin. So it probably could help with the hair as well, but I think there's so much research that has to be done, or data that has to be mined about what it's really doing and what it could do for the hair follicles. But people just want a quick fix and an easy answer, and there isn't any such thing.
I think you're right. I think it'll be interesting to see, as we get used to something, right? Like I do remember the Botox time too, where you're like, make it all stop, make nothing move. And that has definitely changed right now. Less is more. And so it'll be interesting to see what happens as we get more information too, and have more data.
But we're a society that wants to go to the nth degree of everything. Yeah. and that's exciting, but it's not healthy.
No, I understand. I do understand. Okay, my hair is thin since starting bioidentical hormones. Is this common, and what can I do? So that's hormone therapy, hormone replacement therapy, menopausal hormone therapy.
That's such a great question and a great point. I don't think that the hair has thinned because of the hormone therapy. I think it's thinned in spite of the hormone therapy. So one thing I've observed over the 20 years that I've been watching women and going through it myself is that hormone therapy done correctly does help against osteoporosis, heart disease, joint issues, so many things. But I don't think it helps as much for skin and hair at the doses that we're using. Okay. So I'm looking at topical estrogen. I'm doing a study now with a few other doctors. We're looking at topical estrogen, and we're doing epigenetic testing. So we'll have real data on whether or not it's doing anything. And then I can tell you if it actually works for the skin, for estrogen topically. And
this
for the hair.
Your first stop.
Yeah, I know.
This better be your first stop.
You're
if you find
always
out.
my first stop. I love talking to you. But for the hair, it seems that it's not perfect. Okay. So if you have a genetic condition and you're programmed to lose hair, it's not going to reverse that or stop it. It might even be slowing it, but you just don't know.
Right. But that's not going to be you know what I think was confusing, I think a long time ago, before the Women's Health Initiative, they used to do these ads like, find your fountain of youth, estrogen. Yeah. And I think that a lot of those things that weren't necessarily true, we still somewhere in the back of our heads have.
I mean, listen, I was really hoping that doing hormone therapy would stop my skin from aging and stop my hair from falling, but it just doesn't do that. You still age. It's just slower, it's healthier, it's better, but it does not stop it.
Yeah, I know. I'm with you. What about testosterone treatment for menopausal women? Because I actually have been getting this question quite a bit. Some women have had thinning hair with hormone therapy. Is that a real risk?
From too much testosterone.
Okay, so too much testosterone.
Yeah, but the right amount does help hair. So testosterone therapy, if you need it, is good. And women, I think it's helpful for women to do it. And I think it's underutilized for women because there isn't any prescription testosterone for women that's FDA approved. So we're adapting from what's available for men, and we're hoping that works, or we're getting it compounded. But the reality is, I think soon we will have testosterone approved for women, and I think it is helpful for energy, for hair, for libido, for so many things that are helpful. But I stick to skin and hair, and I think it's good for both. But if you do too much, you'll break out, you'll lose hair. So not a good thing, but there's a way to know. And your body will tell you, so you don't even need labs necessarily, although I believe in checking. Yeah. But if you are using too much, back off, it'll get better, and then you'll know the right dose.
And a lot of times a doctor won't re-prescribe it unless on that one, anyone, testosterone, you have to get labs. Not necessarily with estrogen or progesterone, past menopause.
Yeah, although I think you should. I mean,
I agree.
I've spoken with GYNs who feel that once you're in menopause or you're menopausal, you don't need to check labs anymore. Right. But I actually don't think that's true. I think you still need to check labs. You want to know where your FSH is. You want to know if you're really getting good bone protection. You want to know if you're absorbing it. And sometimes the symptoms don't match the numbers. And you're going to wait till your bones fall apart? I'm with you. So I think it's good to check once in a while and then also monitor symptoms as well. But for testosterone, definitely monitor with labs.
I do it. I had gone from compounded to now the men's, which I just do a little small amount of it. And, seems to
it's
work.
So much less expensive. That's what I do too.
It's so much cheaper. It's so much cheaper.
And it works.
Okay, let's talk about red light therapy. Does red light therapy help with shedding?
Red light therapy is FDA cleared as a wavelength for hair growth. So that's fine, but the companies will send you a whole bunch of different price points for their red light. And they'll say, we have this many diodes, or we have low-level laser, and they'll make it so that you need their $10,000 hat. You don't. So it doesn't have to be crazy expensive. There are changes in diodes and the amount of energy delivered, but the idea is to use something if you can. And I like the ones that are hats or helmets because you just have hands free. So the one by Revion, the one by Carefactor are my two favorite ones. Capillus has one. There's a whole bunch of them out there. Some are super expensive. I wouldn't go for those. Somebody sent me one that was like $10,000.
What?
I'm like, yeah, that's what I said. That's
I'd
exactly
break
what
it
I said.
before I got enough use out of it.
Yeah, you don't need to spend that much money, but I think there are some out there that are good, that do help in conjunction with other treatments. You don't have to pick one thing. You can do that with minoxidil, with a supplement, with PRP. I tend to try to have people do things at home before they do things in the office. So I have a hair growth laser in the office that I combine with in-office peptides or in-office exosomes that are topical that I help drive into the skin of the scalp, but that gets to the follicles. But before I have them spend money in the office, I tell them, let's try these at-home treatments so you don't have to be tethered to the office. Because the reality is that whatever you do for hair now, you have to keep doing to maintain the benefits. Even if you get a hair transplant, you still need to do these other things because you don't want those transplanted hairs to be sitting there by themselves.
No.
So everything you do, you have to commit to doing consistently over time to maintain the benefits.
Which I think is why it's probably smart to like find one or find two instead of doing 20 different things.
Right.
And then you're going to just do nothing.
Yeah, one topical, one oral, and a red light. That's a good combination.
It's so nice to have these options. I got to tell you. I mean, I really think so. Is it true that once you stop using topical minoxidil, all the hair you gained falls out?
Yeah. Yeah, it only works while you use it. But it doesn't make more hair fall out. It just lets you know where you would have been without it. So I tell people, whatever you do for hair, you have to keep doing to maintain the benefits for now until we come up with something better. But the good news is if you keep using it, it keeps working. I would tell people, what don't you do forever? You have to brush your teeth forever. You have to eat forever. You have to exercise forever. You have to sleep forever. You have to like go to work forever. Like you do everything forever. That's one more thing you do forever. But it does make your hair grow. It makes your hair grow thicker. And it doesn't stop working over time. So as long as you keep using it, it'll keep working. And it doesn't stop working if you skip a day or two, right? It takes 3 months to begin to see results. It's not going to stop working if you miss a few days. Right. The issue that I have with people is that they feel like if they don't hit every spot when they get it, they're afraid they're not going to get full coverage.
So how do you do that? How much do you need topically?
Just enough to cover. I mean, it's not as much usually as what's on the label, but usually you put your hair into parts and then you just put it down the middle. And then there's like a brush you can get that can help. Let's see. Do you have here? It's funny, of all the things I brought, this brush actually that you have.
Okay.
Yeah, this brush is good that you can then use this to gently massage it into the scalp. But one of the things that I wanted to tell you is that when your hair is wet, you want to use a brush that's designed for wet hair and brush from the bottom going up. Because when your hair is wet, the hair is a little bit looser in the follicles and it's easier for it to come out. So you don't want to pull the hair or do a lot of trauma on it when it's wet. Even when you're getting it blow dried, you'll notice good stylists will sort of dry the roots a little bit, which does make the blow dry go faster, but also helps the hair follicle settle better into the scalp and dry so it's not as loose in the follicle.
Wow.
And then you don't want to burn the hair. So if you're using a brush
Is this a blow dry lesson? I love this.
This is now a blow dry
lesson.
Okay, I'm the last one to give a blow dry lesson.
Okay, it's okay. Just give me the rules.
The more I blow dry, the rules I'm good at. But the doing, Okay, so this one can get really hot.
Yes.
So if you're doing this with a blow dryer, you want to be careful to not hold it too long because you'll burn the hair. And then when the hair is burned, once the hair is off your scalp, whatever you do to damage it, the hair has to grow out. You can't really fix that. You can get a conditioner or something that's going to mask it and coat it. But if you want healthy, pretty hair as it gets longer, don't burn it. Don't fry it over time. So that's important.
I love all the different brushes you brought because I use that one.
I think that is yours.
Oh, it is? Okay.
Now, don't use a rubber band to tie your hair. Okay, if it's in a pinch, it's one thing. But this is going to grab onto your hair and pull it out.
Yep. I've seen plenty of black hair of mine in those rubber bands.
Yeah, terrible. That's because you have so much hair that you can take it for granted. Use softer ones. Okay. And then when I talked about minoxidil, the thing that I said is that it improves blood flow to the follicle.
Yes.
Right? When you put your hair into a ponytail, especially a tighter ponytail, or you get heavy extensions, what you're doing is you're pulling on the hair and you're suffocating the follicle. So you're lowering oxygen supply to the follicle, which over time is going to make your hair fall.
Wait, what are you doing to it? You're pulling it down?
You're pulling it tight, which is putting traction, and traction suffocates the follicle. It reduces oxygen supply to the follicle, which over time will cause the follicle to die. And once the follicle is dead, that's called scarring hair loss. And that hair was never going to grow back. So
what do you do if you decide like, okay, I want extensions though? Do you have to treat those in a certain way in a certain amount of time?
the idea is not to make them too heavy or too tight, which everybody does, because the heavier you make it, the thicker your hair feels, and it feels good. And the closer you make it to the scalp, the tighter it is to the scalp, the longer it takes to grow out. So then you get more for your money that way. And it looks better, but it's not good for the hair. So one thing to do is don't go too dense, not too heavy. You have to be realistic. And two, if you're wearing clip-ins, clip them in a little bit differently every time, and then take them off when you get home. When you don't need it, don't wear it. And just do your best to, I love play hair. Everybody's got play hair. I mean, everybody has play hair. I brought some big play hair, but I also, there's like little clip-ins, there's full-on wigs. Like there's so much you can do to have fun.
Okay, what is this one?
This one, I don't know. This one is hairdo. This is from Hairwear.
Okay.
But there's smaller ones. But the whole point of having play hair is you can go long one day, short one day. If you're great, you didn't get to the hair colorist, you can just put in a clip-in. You can do a strip or a bigger piece or a little topper, it's like a little cap with like hair coming out. But the mistake people make is they go too heavy, too thick, and it just doesn't look realistic. So just do enough, but have fun with it. And who cares if people know? Like go blonde one day, brunette one day, curly,
I think that's
straight.
The fun part of all of this.
Yes,
My
it's
gosh.
an accessory. That's
I mean,
why I
really
call it
is
play
a
hair.
fun part of all of it.
Yeah. And I love that so many celebrity women are starting to admit it. Kelly Ripa was just at the Oscars and she showed putting in her clip-ins. I was so proud of her.
Kelly's great. She's wonderful. And her hair looked great.
So pretty. Well, I mean, she's amazing.
I mean, she's just beautiful, period. But it was amazing.
We are gushing.
We are. That's okay. Let's talk about expensive hair vitamins. We talked a little bit about some supplements. Do you think they're worth it?
I do think Nutrafol has really good data. I do think that one is worth it. My mom does call it the miracle pill. She's 93. And the only thing she cannot run out of is Nutrafol.
Okay.
So she bugs me over that. But it's not for everybody. I have patients who can't tolerate it. They get stomach upset. So and it does have a cost to it. But I think that Roland, who helped develop it over, 10 years ago, 15 years ago, put a lot of effort into sourcing the product, studying what helps to grow hair. And I think it set the standard of good supplements for hair. I think they're working on the formula, trying to upgrade, but Nutrafol Balance seems to be a good one. Extra Say is one, I brought that with me as well. So this is Nutrafol Balance for women. And then Extra Say is one that's designed by a dermatologist.
Okay.
So I think that's also a gummy.
All right.
And that has a bioactive blend. Some of the ingredients overlap. I definitely wouldn't do both. But for people who don't want to take 4 pills, you can take a couple of gummies.
I know Nutrafol has had a lot of data behind it, and I think that is reassuring. We had somebody come on the show, and I was so shocked by so much of the data, which was really reassuring. Yeah, it was great.
No,
it was
their
really great
data
to see
is
that.
good. The sourcing is good, and the amount of testing that they do is really prescription grade testing.
Okay.
And then
what is this one?
love Boldify.
Boldify,
This
I like
is
the name.
a powder. And this one is as true to color as I've seen. So if you feel like you have like a thin spot, you just put this powder on. And what's nice about it is that it doesn't look like shoe polish. Some of the other ones, as they got darker, got more purple. This stays close to a brown and it just rubs off, but it's a hair fiber expander. So it makes your hair feel thicker. It only goes from shampoo to shampoo. So it's not like it's growing hair, but I think this is a nice one. And they have one in a pot that you can do to just cover the roots as well. And there's other brands as well. There's Topics, there's Color Wow, there's a couple of other ones. I like all of them, but Boldify is my current favorite.
And that's a great solution for a temporary solution. I love their bag of tricks.
This is the pot. And then on the bottom, it has the sponge. So you can just do this, and then you can kind of go along the roots and cover gray or just cover the scalp.
That's great.
Yeah, so this is kind of a
great
cute.
for in between grays.
Yeah,
right?
This will buy you some time.
That will buy you some time.
And they're good color matches with this brand.
What shampoo brands actually help with hair loss? Are there any specific ones?
They really support hair growth. One that I really like is by Redken. It's the acidic bonding concentrate. So if you feel like your hair is thin, it has citric acid in it, which is a hair bonder, and that will make your hair feel thicker.
Okay.
You use that shampoo and conditioner for a few shampoos, and your hair will feel 3 times thicker or 5 times thicker. It's crazy. I actually helped CeraVe with their shampoo line. They have one for dandruff and one that's gentle. They have citric acid in that as well. But it's amazing how much the drugstore brands put into hair growth. My favorite brand that's more on the medical grade is Carafactor. And that is a shampoo and a serum that has peptides and botanicals. And that one mimics growth factors that your scalp needs and your hair needs for hair growth. So that is, I think, probably the best one on the market for hair growth. And I've had patients where we do so many things, and when we add that, they're like, oh my God, now I see the difference. And that makes me so happy.
Yeah, of course. I think what's also great is the drugstores have it now, and there's you have different options. So if you're not able to go to a dermatologist, or you go to your dermatologist and they say, go to the drugstore and get this, it doesn't wind up being like crazy costs to be able to, I don't know.
And Vichy Durkos is another one. Vichy, the Durkos
Vichy's
line.
always good.
Yeah, Vichy, that shampoo, that's maybe $20. The CeraVe one is $10. There's so many great ones. The Carafactor is a little bit more expensive, but what I usually recommend is doing a double shampoo. So you'll use one, you can do one with one of the anti-dandruff shampoos, and then the second one with more of a peptide-based shampoo that's going to support the follicle growth. And this way, you're not doing a double shampoo with the more expensive one.
I hear this all the time. You're not supposed to towel dry your hair when it's wet. Is that true? Because you showed us how to brush, but you can't towel dry your hair when it's wet?
You can towel dry. It's the same idea of not pulling. You don't want to shear the hair, and you don't want to pull the hair. So if you gently pat it dry, that's fine. And there are towels that you can just wrap your hair in that absorb the moisture, and that's fine.
Yeah, that's what I do.
You definitely just don't want to pull your hair or shear it. Like if you take a ribbon and you rub scissors across it, you know how it makes the ribbon curl? Your hair will do the same thing. If you shear your hair when it's wet, you're going to fray the hair, and it's going to make it coarse or wavy or frizzy or actually break.
Wait, when you shear it, what does that mean?
When you shear it. So if you take a harsh brush or a harsh towel and you rub your hair really dry, and your hair's already dry and somewhat damaged, you're going to shear the hair, you're going to abrade it, and that's going to make split ends. It's going to make the hair more damaged and ultimately look frizzy and dull and break more easily.
Okay, last
thing
we want.
So just be gentle.
Just be gentle. All right, final question. What are some of the ways I can help with hair loss that don't require me to take medication?
You can do topical minoxidil. You can use an antifungal shampoo like ketoconazole shampoo. You can take the supplements, and then just make sure you have a good diet, get enough protein in your diet. Just look at all the things in your life that could be driving your hair loss. If you have just general aging of the scalp. A lot of times people will come in and they think they have a hair problem, but they don't. It's just hair naturally aging, or it's something in their life. If you actually have a scarring hair problem, you need to see a dermatologist because that requires in-office treatment. So scarring is when the follicle is lost. And around perimenopause and menopause, women get something unfortunately called frontal fibrosing alopecia. And it happens in all ethnicities, but it's when you start seeing loss of hair at the follicle, at the frontal hairline, and you can see redness around the follicles or just the front hair receding and the skin looks waxy smooth, or it looks like you have plugs of hair there. So we use injectable cortisone for that, just very low concentration monthly to try to slow that down and turn it off. And a lot of times we can really protect that hair loss. So it's not a female pattern problem, but that's a scarring pattern that you should see your doctor for. So if you don't want to take medications, there's so many things. We've talked about so many of them, but see your dermatologist, somebody who cares about hair, who will hear what you have to say and see what the best things are. And sometimes it is about medications, it is about hormone therapy, and we can work around it, but that would be the shortest cut and the safest one because your hair is sometimes telling you about your body. And you don't want to just mask the problem and treat the hair without reading what else can be going on. And then you suffer later with osteoporosis or frozen shoulder or dementia or heart disease when we could have looked and asked you more questions and help you get to the right doctors to make sure your whole body gets taken care of.
I love that you make women feel so powerful. And you know, I remember you saying sometimes I know that a woman is in perimenopause or menopause before she's even even gone to the OBGYN just from looking at skin, or I guess even hair probably, right?
Absolutely. Absolutely.
Dr. Day, thank you for being so incredible. And thank you for your bag of tricks. I love it all. All right. To all you ladies listening, I hope this episode got questions answered for you. And I hope you feel more confident going into this next chapter, knowing you have some options, you have tools, and you're definitely not alone. If you are listening, you can actually see this over on YouTube and see some of the products that Dr. Day brought in. We'll also put them in the show notes for you. And if you have any more questions about any topic, call or text us at 917-382-4277. I would love to hear your beautiful voices. If you love this episode, tell me what you learned by leaving a review. It genuinely means the world to me and helps so many more women find the show. Thanks so much for being here, and we will talk next week. Today's podcast is sponsored by MIDI Health. So many of you know this, but I was dismissed over and over again when I was struggling with perimenopause symptoms. I didn't even know I was in perimenopause. It is so important you're getting care from someone that specializes in women in midlife and that they're willing to have the hormone therapy conversation with you. I get questions from you every single day about where to go for support, and I'm always suggesting MIDI Health. It's covered by insurance, and you don't even have to leave your house. Ready to feel your best and write your second act script? Visit joinmidi.com/Tamsen today to book your personalized, insurance-covered virtual visit. That's joinmidi.com/Tamsen. MIDI, the care women deserve.